All right, thanks guys. Thanks to Sages for letting us present this data. My name's Zach, I'm a fellow at North Shore with Dr. Ujiki. I have no disclosures. The surgical treatment of acid reflux has changed tremendously since the Nissen fundoplication was first performed over 60 years ago. Just as partial fundoplications have grown in popularity, new technologies to treat GERD have emerged. Magnetic sphincter augmentation is becoming increasingly utilized due to shorter operative time, length of stay, ease of reversibility, and reported less post-operative gas bloat. One of the least invasive treatment options is anti-reflux mucosectomy, which uses endoscopic mucosal resection to tighten the GE junction. With these methods and others available to our patients, it becomes essential to determine which procedure is best. We performed a retrospective review of prospectively maintained database comparing Nissen, Toupet, MSA, and ARMS. We specifically examined length of stay, specifically examined length of procedure and stay, complications, and quality of life. Here's the preoperative data. Patients in the Nissen and Toupet groups were older than MSA and ARMS patients. ARMS patients also had a lower preoperative BMI compared to Nissen and Toupet. In terms of preoperative symptoms, a high proportion of patients in all groups presented with typical GERD symptoms, but patients in Nissen and Toupet groups experienced a higher proportion of dysphagia. Operative time and length of stay was significantly shorter in MSA and ARMS groups. Additionally, ARMS had a shorter median return to daily activities. The rate of complications was similar in all groups. Interestingly, the Nissen group had a higher hernia recurrence rate, but also had nearly twice the amount of follow-up. In terms of quality of life, GERD HRQL scores were similar among all groups at all follow-up points, with the exception of MSA patients having a higher score at 1 year compared to ARMS. This suggests worse typical GERD symptoms at this time point. This difference did not persist at 2 years. At 5 years follow-up, the MSA group had a higher RSI score compared to Toupet, signifying worse atypical GERD symptoms. Sample size is admittedly small at this time point. There's a few limitations worth noting. First, the retrospective nature of this study prevents blinding or randomization. Second, there were preoperative differences among our patient groups, including age, BMI, and gender, which may affect our results. Lastly, at 5 year follow-up, the sample size is quite small, limiting extrapolation at this time point. So in summary, this is the first study comparing Nissen, Toupet, MSA, and ARMS. We found that these new GERD procedures seem to be superior with regards to operative time and recovery. Despite minor differences in typical and atypical GERD symptoms at isolated follow-up time points, quality of life scores seem to be similar after all 4 procedures. Most interesting is the equivalent gas bloat among all 4 groups. Thank you.
Excellent. I see no questions in the text, but I see Dr.